For months, we heard contact tracing would help bring the pandemic under control, but will that work? We asked our Vince Gerasole to find out, and Vince, there's concern contact tracing may not be a match for the magnitude of COVID-19.
And there are a whole bunch of reasons why that's a factor, Erica. First of all, the nation can't seem to churn out enough contact tracers fast enough. And then there's this challenge. Apparently, some positive patients are not calling contact tracers back. After all, it is a call from a stranger asking some very personal questions.
I decided the only way that I could really help is that if I became a contact tracer.
So retired Chef Ina Pinckney went online for certification through the Johns Hopkins University Contact Tracing Program.
The purpose of contact tracing is to
It's very difficult to get people to talk to you when they don't want to talk to you.
The trainings emphasize the challenges of mapping COVID-19 by connecting with those who have encountered a positive patient and may unknowingly be positive themselves.
You're dealing with people's private lives, and some of them feel like the government shouldn't know everything.
Nationwide, spikes in new COVID-19 cases reached 48,000 yesterday, the most in a single day. Because much of the spread involves large public interaction, Dr. Anthony Fauci, the nation's top infectious disease expert, says contact tracing may not be as effective as once hoped.
That is very difficult to make that work under those circumstances.
With the current uptick, it can overwhelm the contact tracing infrastructure, there's no doubt.
Dr. John Schneider from community-based Howard Brown Health directs a team of 50 full-time contact tracers locally. He worries the neighborhoods coping most with COVID-19 may be reluctant to take a call from a stranger because of community struggles with immigration or the policing system.
A lot of these communities that are getting hit hard by COVID are black and brown people.
Do you feel we have enough in the Chicago area?
We don't have enough yet.
There are roughly 100 contact tracers in Chicago, and the city has just announced partnerships with local schools to train 600 more tracers who have to confront the challenges.
So there's a lot of very careful treading that you have to do.
Here are some instances where problems with contact tracing went to extremes. In San Antonio, Texas, there were 2,500 positive patients that were contacted by these tracers. Only about 300 bothered to call them back. And then in the city of New York, they had roughly 50% respond. And it's recommended by public health officials that 75% should respond if the program is going to have any impact at all. Reporting live in Edgewater, I'm Vince Gerasole, CBS 2 News.
So, Vince, you mentioned 600 more tracers coming online in Chicago by the end of the summer. Will that be enough?
All right, Erica, the important factor here is that if levels remain where they are right now and we get this influx of contact tracers, we should be okay. But if those numbers, COVID-19 numbers, start to spike, we may need more than these 600 extra contact tracers in the city of Chicago alone. Here are the numbers now. It's recommended that there are 30 contact tracers for every 100,000 residents in the United States. So that's how they come up with the need for 100,000 nationwide. Right now, there are only about 28,000.
And okay, let's go back to Ms. Pinckney, because she was talking about many of the roadblocks. People don't trust those people that are contacting them. I know she wanted to do this to help out. Does it seem like it's something she's going to continue to pursue?
She's dedicated to it, and one of the reasons is that she has what's called post-polio syndrome. She actually suffers from polio, can't walk very well, and she knows the difference that a vaccine made. She saw how the nation had to respond back when polio was a significant threat, and she wants to make sure that she's on the front lines of this next type of pandemic to try to make a difference.
All right, Vince, thank you.